In this video, we are going to look at how to look up and code Chapter 21, the factors influencing health status and contact with health services codes. So these are codes Z00 to Z99. So you can see they're in the very back of your ICD-10 CM codebook, Chapter 21. But let's go to the front of the index and look at ways to look up the Z codes. So remember that the Z codes are factors that influence health. So it doesn't have to be a specific disease right now. It can be a former disease coming in for admission to treat a disease or examination. For example, maybe our patient's coming in for a yearly pap smear and gynecological visit. Maybe our patient's coming in for exposure to chemicals or a medical examination for work. So the way you want to look these up is really by the category, like admission for, examination of, exposure to, history of, status post, those kinds of things. So these are activities that might influence the patient's health, histories that influence the patient's health, not a current illness. So let's just look at some of these. For example, if we go to the index and go to admission, you can see we have lots of these Z codes. Admission for adjustment of an artificial arm, leg, eye, breast implant, breast prosthetic, brain neural pacemaker or implanted, colostomy belt, dental prosthetics. You can see lots of admissions to look at something or exam the patient for a specific something. Attention to any kind of ostomies, right? Colostomies, enterostomies, gastrostomies, you can just see. So I would encourage you to look through the Z codes. Again, Chapter 21. All the guidelines, remember, always at the beginning as well. So look at the guidelines. But I would encourage you just to look through, take a few minutes, 5-10 minutes, just look through the different kind of Z codes, screening for protozoal diseases, encounter for testing for latent TB infection. So just look through some of these. Retain foreign body fragments. There's lots of different Z codes that are just impacting a patient's health, not a current disease or illness per se. So we're going to look up 3. Again, I encourage you to stop and pause the video and see if you come up with the correct answer. One thing I want to point out in the alphabetical index, though, that's very important when looking up Z codes, is the history of section. So history of, we can see it starts right here. What I want to note is there's family history and there's personal history. These are not the same things, right? Family history is the family of the patient. Personal history is actually the patient's own history. So when you're looking at these, when you go to the alphabetical index, go to history, we start with family. Family is the whole first column, second column, all the way down to the bottom here to where it says personal. If I was you, I would mark this, highlight it, something in your book to note that there's a difference. And why is this important? Well, it's important because the codes are going to be different. Let's just take malignant neoplasms. If we looked up a family history of breast malignant neoplasm, we get Z80.3. If we look up personal, and then we go to malignant neoplasm, right here, and go to breast, Z85.3. So you can see family history, personal history, totally different code set. So you need to make sure when you're looking up diseases under family history, you're under that indentation. If it's personal, make sure to go all the way down to personal and then start looking. Okay, so let's start with our first scenario. Our patient's coming in who is going to join the Air Force and is coming in for a medical examination for admission into the Air Force. So again, pause the video, unpause it when you think you have the correct answer, and we will go over it. Okay, so hopefully you guys have unpaused and you have Z02.3, encounter for examination for recruitment to armed forces. Now, how did we look that up if you did not get that? We went to E to examination, and then we went to medical. Examination, medical, admission to armed forces, right there, Z02.3. Okay, let's do our next one. Our next one, our patient had an exposure to COVID. So what would our code be? Again, pause the video, unpause when you think you have the correct answer, and we'll go over it. So hopefully for that one, you guys have Z20.828, Z20.828. Contact with and suspected exposure to other viral communicable diseases. Now we have a tip even right here. The tip says, assign for cases in which there's actual exposure to someone who is confirmed or suspected, not ruled out, confirmed or suspected to have COVID-19, and the exposed individual either tests negative or the tests are unknown. If the exposed individual tests positive for the virus, we would assign U07.1 for an actual COVID infection. So our patient had just exposure to it. So that's what we're going to do, the Z20.828. And to look that up, again, you go to the category. So in our alphabetical index, we're going to go to E to exposure. And then once we get to exposure, we're exposed to, or our patient was exposed to, a communicable disease that was viral. Okay, one more. Now I want you to find the code for family history of colon cancer. Again, pause the video, unpause when you think you have the correct answer. So you guys should have found Z80.0. Remember to look under family history, not personal. So Z80.0, family history of malignant neoplasm of digestive organs. So you have to know where the colon is. You can't get every single organ like in the regular neoplasm table. There's more categories in the history of. So if we go back to history of, to look this up in our alphabetical index, we're going to history of family. Then we're going to pick malignant neoplasm, digestive organ, Z80.0.